Hi, Dr. Surgeon.
Hi.
So nice to have you here today, and I hope we can talk about some of the great things you're doing here at Afiya. You've been with us essentially since the beginning, since the opening. So we've been open, about 15, 16 months, almost a year and a half, and we've had kind of exponential growth of our clinic. And it's really, due to all the great people that we work with, the great doctors, the great staff, the great support staff, and also, most importantly, the great patients. And you've been the champion in doing something that a lot of the academic hospitals are doing, and we're doing it here in the community for patients, and those are the pain classes. So, we have pain, and we're all interventionalists, interventional pain physicians, but there's so much more to pain, and we really believe in the multidisciplinary model for pain care, and that's that's the best patient care. Would you agree with that?
Yeah.
So I just want to talk to you about how the pain classes are going, what kind of are your objectives, kind of your goals, and most importantly, what have you seen as differences in patients and some of the feedback that you've got from the pain classes?
Yeah, so the original objectives with the pain classes was to get a group of patients together with similar diagnoses of different types of chronic pain, fibromyalgia, but really any chronic pain diagnosis, and to get them in the room together with one of our experts, so myself as a family doctor, sometimes some of our pain physicians, sometimes some of our counselors or psychotherapists, and to just have a space where people can learn about their chronic pain, learn about their pain condition, why it's important to have this multidisciplinary approach to pain, and why these other things other than just medications and interventions are important to help them in their pain journey and in their journey to recovery. And so that's what we've been doing. We've been bringing patients together in these groups and running these sessions, and they've looked very different. So we have been kind of experimenting with lots of different ways to run it. We've had smaller groups, larger groups. Sometimes we have had single sessions where we talk about one topic that patients have kind of brought us that they've been interested in. And then sometimes we have sessions that run over 6 weeks where we bring the same group back, and each week is sort of a different topic or a different learning experience, where they get a little bit of homework or assignments to kind of take home, and then they're able to come back the week after, talk to the whole group about how that went, what they learned, what they've been experiencing. And we have had incredible feedback from it so far from patients.
My patients, I would agree, and it actually helps me with their interventions. It helps them, patients have been suffering for a long time, and what some people don't realize is pain can affect so many parts of any part of your body, but really that mental health aspect, that psychological aspect is so important in getting them back to doing what they want to do, enjoying life, getting back to work, whatever their goals and objectives are. And a lot of the patients that I've sent to you have given me excellent feedback, and they're on their journey towards a pain-free life. What are some of the topics that you would discuss, Jen? I know you have a variety of different things that you do and different objectives for certain patients, but what are some of the things that you focus on, and some of these things that you focus on, what do you find is most beneficial from a day-to-day perspective for these patients?
So some of the focus is sort of in understanding their pain, because their pain is usually with them throughout the whole day, and all the activities and things that they're trying to do throughout their day. So having an understanding of what is causing their pain and an understanding of why certain things might trigger or help their pain. So one thing that Afiya is very big about is that even though your pain might not be visible, we still see it, that pain is still real. And so we spend a lot of time talking to patients about how your brain does interact with that pain pathway. And that doesn't mean we think your pain is in your head. It just means that because there's so many things impacting your pain, things that are going on in your brain also impact your pain.
I love that you said that, because it's really important that we sympathize with our patients. We tell them that we believe you. Your pain is real, and it's not in your head, right? And so really connecting that pathway, and then also I feel in my patients it's giving them a lot more confidence, right? Because they don't feel like it's a disability. And really, when we piece everything that we do here, whether it's medication, interventions, psychological assessments, and your pain classes, I think it's truly made a big difference. And so when's your next pain class?
So we have one tomorrow, and we're excited about that. So what we've been focusing on in that one is helping patients to be able to communicate their pain to physicians and to other people in their life. So we've been talking about the like OPQRST, which is one of the ways that doctors will look at pain. So like their onset and how they can talk about each of those characteristics of their pain so that they can talk to physicians about it, they can talk to other people about it, and it gives them a better understanding of some of the questions that we ask them at their appointment. So we've been doing some of that on Saturdays, and then tomorrow we're also going to be doing a couple different types of meditation and talking about how we know that increased stress, increased anxiety in the brain can actually increase the pain pathway and the pain signals that the brain is picking up, and ways that meditation and different types of breath work can help to dampen some of those signals and help your body kind of control your pain pathways going forward.
I love that. Do you mind if we join you tomorrow at your pain classes?
Of course.
To see it live?
The more the merrier.
Perfect. Thank you for your time, Dr. Surgeon.